have not had. All right, thank you. For those of you that I have not had a chance to meet yet, welcome. And my name is Tommy Sheridan. I'm Deputy Director at National Head Start Association, and it is my absolute privilege to welcome you to today's NHSA webinar on the final rule, entering the new phase. Which, of course, this final rule contains significant changes to our existing Head Start program performance standards. Now, today we intend on really walking through, getting into the weeds about the final rule, addressing as many questions as we can. And before we dive into any of that stuff, though, I'd like to ask everybody to join me in just taking a collective breath of air. It has been a sprint these last several months, and I think we all could use to just take a deep breath and get ready to dive in. So now, ever since I started working with Yasmina at NHSA about 15 years ago now, one of the most important lessons that Yasmina has always taught, and I think one that I learned and relearned and continue to relearn over and over, but one that I think is really important to kick off our conversation today, is a concept that she actually picked up from her graduate studies in public administration. And that concept is that change is emotionally most experienced as a loss, regardless of how much or of how we felt about things before or how good we think that things might be going forward. Again, change is experienced most often emotionally as a loss. And I think that this final rule certainly reflects a major change to Head Start and early Head Start. And I got to acknowledge that I think probably a few of us are feeling a little bit of that sense of loss and, again, confusion moving forward. But that's really what I hope today and these next few weeks will really help to address. The second thing I want to flag comes from my being aware that a considerable number of you are new to Head Start and may not entirely be sure about how we, the National Head Start Association, differ from the Office of Head Start, and about the unique ways in which both the Office of Head Start and the National Head Start Association work, and how our work kind of complements in different directions. When I first came to Head Start, again, back about 15 years ago or so, it took me some time to figure out how best to explain it. Even to my own grandmother, rest her soul, who always thought that I worked for the federal government, regardless of how many times I tried to tell her otherwise. But then Yasmina came up with this rough metaphor, and please bear with me. These are her words, not mine, but I think that they paint a good enough picture that they're worth sharing. So first of all, I think it's important to acknowledge that both the Office of Head Start and the National Head Start Association are committed to Head Start as a program that reflects our nation's commitment to young children and their families. Both of us do that. But to a local Head Start program, the Office of Head Start and its regional offices are more like your parent, right? Sometimes pretty strict, sometimes old-fashioned, but your parent, right? They set their expectations for you. They tell you what to do. They give you your allowance, also known as a grant, and they basically tell you and work with you to figure out how you use it in certain ways, namely in ways that they approve of. And they make many decisions about what you can or cannot do. When you break any of the rules that they set, whether it's in the standards or information memorandums or program instructions, they often administer the unpleasant consequences, right? Whether that comes from DRS, the Designation Renewal System, Full Enrollment Initiative, the RAN, Risk Assessment Notification, or a deficiency. So that's the Office of Head Start. Again, kind of like your parent. Now, NHSA, and again, in Yasmina's words, not mine, has a very different relationship with you. We are your sweetheart, right? For lack of a better term. We believe in your mission, in your commitment. We admire you and your work. We listen to you talk to us about your life, about the challenges, the successes, your pains, your discomforts, and we try to soothe those, right, as much as we can. We also empathize and sometimes sympathize when you feel like your parent is being unfair or unreasonable. And sometimes, in such cases, we even go and try to talk to your parents, maybe convince them on your behalf about all in the hope of making you feel more supported in the high stress work that you do. I mean, frankly, we also go to your parent and their finance person, aka Congress, to try to get you more allowance at times as well. And most recently, we did a great deal of this, working with you to develop a comprehensive response to the notice of proposed rulemaking that became the final rule that we're talking about today. And as you will hear from our presentation of my colleagues here today, this collective work and the response that it bore, the response that came bore much, much fruit, and something that we should all be very proud of. No, all that said, there is one difference which we can't really fit into this metaphor, and it is, as I was just noting, that the Office of Head Start, beyond working on the president's budget, cannot directly advocate for or really substantially change the additional funds that might be appropriated or provided by Congress. And here is where, together with you, NHSA and you and the whole Head Start community has an opportunity and has existing proof of being quite successful in securing bipartisan support for the funding that is needed, even in very difficult and tight years. Here also, as you listen to the presentation, you will find that we will need to work together. We'll need to work hard to secure the needed funding to implement these standards, right? Which have some really wonderful, wonderful things, wonderful goals and aspirations in them, but we need those resources. And together, we're going to be able to do that to ensure that Head Start and Early Head Start and all of your colleagues are able to continue to change as many lives and break as much generational poverty as we can. Now, lastly, before we dive into it, I want to just say thank you. Thank you for joining us today. Thank you for your participation throughout this whole process. And most importantly, thank you and all of your colleagues for what you and your teams do every single day for children, families, and communities across the nation. We really are thrilled to be your sweethearts each and every day. And while we may feel a sense of loss with this major rule change, we also know that we in Head Start are going to find a way to make the best out of it for the children, for the families, and for the communities that we serve. Now, before I turn it over to my colleagues to get into the specifics, I did want to acknowledge just a couple of housekeeping items. First of all, due to the capacity of today's virtual meeting, we have quite a number of folks on here and all registered very quickly, which no surprise, this is an important conversation. Because of that, you're all on mute. We invite you to please use the chat function here to type in any questions, as I see folks are already doing, and any comments as the presentation goes on. We will answer them to the best that we can during the presentation, either directly in chat or at the Q&A time, the question and answer time after my colleagues walk through more of the specifics around the final rule. I also want to acknowledge that this is being recorded. The recording and the slides will be available on NHSA's webpage after the webinar, and you will receive a follow-up email with this. We know that there's a lot of other folks that wanted to make it. We're not able to today, so we did say we'll record and make this available for future uses. So again, please keep dropping questions into the chat throughout the presentation. We'll get to as many of them as we can. We will be sharing the slides that we are using, as well as I said, the recording. And if you have questions after the presentation, please email them. We set up a new email account so that a number of us can track it. Please email us at finalrule@nhsa.org. That's just finalrule, one word, @nhsa.org. Now, without further ado, let me turn it over to my colleague, someone that you have heard from many a time throughout this whole process, somebody that deserves quite a lot of credit for the whole pulling together all of the comments and continuing to push throughout this whole comment period, and then also unpacking this final rule as we got it all. NHSA's Senior Director of Policy, Kathleen Havey. Kathleen?
Thanks, Tommy. Hi, everybody. Good to be with you today. Ann Lenahan and I have a lot to run through. And so just right at the top, I wanted to make sure I introduced my partner in crime, Ann Lenahan, who most of you know as the former Deputy Director of the Office of Head Start. And we've had the privilege of working with her over the past year or so here at NHSA and have benefited greatly from her wisdom and insights and all that kind of stuff. Ann and I are going to be tag teaming this presentation this afternoon. Hopefully all of you will stay awake. We have an incredible number of slides. I'm a little chagrined to even tell you what the final number ended up being. But some of them will be there for reference points that we might zip right on past, but you'll have them as something that you can refer back to. In addition, we have a pretty detailed summary that we'll be putting out in the next day that also will go into a lot more detail as well. So without further ado, let's dive in. So how did we get here? Maybe you're brand new to Head Start and you're saying, what am I doing on this webinar? I don't even understand the backstory. This slide is for you. Really quickly, so November of last year, the proposed rule was issued with a comment period of just 60 days. We, the Head Start community, rallied and used those 60 days to really assess and reflect on those proposals and make strong recommendations for change. And we made ourselves heard with more than 1,300 comment letters, most of which were unique, joint sign-on letters, including one from about 25,000 parents. And I'm happy to say that our unified voice really did result in a much improved final rule. Your input mattered. Here are a few examples of the changes that we interpret in a positive direction, thanks to the unified voice from the field. First, many overly prescriptive rules that were proposed in the NPRM, while well-intended, were definitely in the micromanaging category. And those we were grateful to see were dropped or revised. Things like the mandatory 5-minute breaks, adult-sized desks and chairs in every classroom, etc. Other notable changes to one of particular significance responds to the concerns of smaller programs. And so we'll get into further detail about the exemption for pay parity and pay floor and a couple of other things for programs with 200 or fewer slots. The final rule increased program flexibility to implement the new rules, things like a mental health multidisciplinary approach instead of having to set up a multidisciplinary team. Additional flexibilities with respect to staff wellness and lead abatement, etc. So we are grateful for those changes. And then last, but certainly not least, the final rule really did take seriously our concerns about what we saw as over-reporting of incidents, and instead recalibrated and focused instead on the serious incidents that can and do need the most attention from the Office of Head Start. So like I said, the final rule published in the Federal Register yesterday. The compliance date for most of the requirements is 60 days from yesterday, which is October 21st, unless otherwise noted. And some of those little footnotes you'll see throughout the PowerPoint as well as in our summary. So yeah. Next slide. A couple of highlights just to lift up before we go section by section. First of all, the exemption for small programs of 200 or fewer slots for workforce compensation and benefit requirements. The mental health multidisciplinary approach instead of a multidisciplinary team. The plan to prevent lead exposure, programs will have to have a plan for that instead of a one-size-fits-all testing mandate. The staff conduct regarding non-serious or not significant incidents is much more in the hands of program leadership now. And then last, an emphasis on staff wellness policies and practice with flexibility on how to implement those policies. So as I said, we're going through a high-level overview of the rule, lightning speed. I'm already talking fast. I might even speed up if time requires it. We will also set the foundation for future workshops and other possible gatherings. We'll also collect your questions and comments, which will help. If we can't answer them today, they'll help certainly inform future webinars and resources. And I should note that we also will share anonymously the questions we receive from the Office of Head Start, because they will be doing their own second webinar next week, as I'm sure you know and you've signed up for most likely. But in our collaborative approach, we will be sharing those questions with them so that they know what's on your mind. All right, workforce supports. This is the first major section that we are going to dive into. If you could get to the next slide, thank you. The significant changes with respect to compensation, workforce compensation. This is where the bulk of the cost comes in the rule, not surprisingly. And the final rule tries to balance the needed quality improvements and frankly, especially with respect to compensation, with the need to serve children and families from high needs situations. And this balancing approach we see in a number of different ways. First of all, the conditional waiver, I'll talk about that on the next slide, but also for small programs, excuse me, also pay parity. Another way of measuring pay parity will be against 90% of a kindergarten teacher's salary, instead of only being able to compare to a public pre-K salary. And then large programs will be particularly happy to know that programs that exist that are in multiple school districts do not have to have multiple pay scales. They can pick one or multiple ones as they see fit. And then finally, there's the possibility of a waiver if we're in an extended environment of very low annual appropriations. So let's talk about this waiver for small programs, which is to say programs with 200 or fewer funded slots, or also interim service providers. So they are exempt from most wage and benefit requirements, but they do still have to establish a salary scale that promotes competitive wages for all staff and make measurable progress in staff wages, including the disparities in wages between Head Start and public preschool teachers. So you're not completely off the hook. You do still need to be making progress, but that will be measured differently for programs that are small. So for those that are above 200 slots, there are some additional flexibilities included in this final rule. Number one is that pay parity can be measured against 90% of a kindergarten to third grade teacher's salary as an alternative to public preschool teacher salaries. Also, and as we do have a little bit of repetition in these slides just to kind of hammer home some of the more important changes. So as I just mentioned a minute ago, programs that are in multiple school districts do not have to have a pay scale for every one of those school districts that is comparable, but they can choose to do so if they wish, or several pay scales or what have you, but that is on you. That is not required by the Office of Head Start. Also, an important clarification for parity purposes, education staff salaries can be adjusted for schedule or hours worked. And also wage standards apply to all education staff who are employees or whose salaries are funded by Head Start through a contract. This includes child care partnership sites, most notably. Minimum pay and wage comparability. The final rule retains a minimum pay requirement sufficient to cover basic costs of living in that geographic area for all staff. And that is calculated based on if the worker's hourly wage were paid according to a full-time, full-year schedule. Wage comparability between Head Start preschool and early Head Start remains in the rule as well, and that eliminates the disparities in pay between Head Start Preschool, we're going to have to get used to calling it that, and Early Head Start for staff with similar experience and qualifications and hours worked, that kind of thing. Okay, so there is a waiver. There is a just in case, because these things are really expensive, right? And so in the final rule, OHS came, created a bit of a waiver. The secretary may establish a limited waiver in 2028 for most wage and benefit requirements if, this is the important part, appropriations increase by an average of less than 1.3% in preceding years. Now, I think it's important to really point out that this is a very low threshold. Over the past 10 or 12 years that we've looked at, there has not been a 4-year period during which appropriations have been less than 1.3%, which leads us to question the likelihood of this waiver actually coming into existence. So I don't want you to be thinking, oh, don't worry, this waiver is going to happen, because it is in fact a pretty strict waiver. OHS is really standing by its proposed changes to compensation for Head Start staff. So there are some details though. So let's say we are in an extraordinarily tight environment, and we're below that 1.3% threshold. There are some quality benchmarks that programs would have to meet, and they would still have to show that they're making progress towards pay parity. So those details are years down the road, but just know that it's out there. And as a reminder, because I don't think I mentioned it yet, all of the pay parity requirements, they do not fully take effect until 7 years from now. So there's a long ramp up for those. Staff benefits, pivoting over to those, again, like with compensation, small programs and interim service providers are exempt from benefit requirements. The final rule continues to say that full-time is 30 hours. They did push back the compliance date by 2 years, though, to August of 2028. So there's more time to comply to these changes. Next slide. Okay, employee leave. This is an important one. The programs must offer job-protected periods of leave consistent with eligibility for and including protections in the FMLA to the extent to which that's applicable to your organization. So the paid family and medical leave and applicability to all programs were both dropped, and instead basically current law applies. And whoops, if you could go back 1 second. The other change is that full-time staff, paid leave for full-time staff does not differentiate between vacation leave, sick leave, or personal leave any longer. So those can be combined, and the specific accrual rate requirement was also dropped. So some added flexibility there. Other staff benefits for full-time staff include that programs must provide or facilitate access to high quality and affordable health care, and full-time employees must have access to outpatient behavioral health visits annually. The minimum in the NPRM of 3 to 5 visits minimum was dropped, so it just has the rest of the provision in the final rule. Now, for part-time staff, at a minimum, programs must, with respect to health care, facilitate enrollment in a health insurance marketplace or Medicaid. Then for all staff, additional benefits include that programs must facilitate access to the public student loan forgiveness plan, public service loan forgiveness plan, excuse me, childcare subsidies and other relevant benefits. Programs may prioritize enrollment of staff children through selection criteria, And then this is an ongoing thing. This isn't meant to be a one-time thing, and programs need to self-assess at least every 5 years to make sure that they're keeping up with their community, market changes, et cetera. Staff wellness. Okay, so we could focus, on what changed and what was dropped. You see that at the bottom, the mandatory spontaneous 5-minute breaks, other specific break minimums, and adult size furniture mandates were all dropped. But it's really important. I think OHS would want to make clear that staff wellness is a priority for them, and it should be a priority for program leadership. And so it is incumbent on programs to make sure that they are keeping their staff in mind. And so they must provide regular breaks of adequate length and frequency, comply with more stringent laws or regulations if applicable. Furthermore, staff who are on break may be replaced by a staff member who meets training and requirements for safety. And again, cultivating a program-wide culture of wellness is also a priority for OHS. So, speaking of staff, training and professional development. Programs must establish and implement a systemic approach that is integrated with employee engagement practices and includes, at a minimum, the following things. An individual professional development plan developed with employee input for all full-time staff who provide direct services to children. Annual mandated reporter training for all staff. Annual training on positive strategies to understand and support children's social and emotional development and tools for preventing and managing challenging behavior. And last, training for child and family services staff on best practices for implementing family engagement strategies. Okay, I will now
Well,
turn it over to Anne to take us through our next section.
thanks, Kathleen. I hope I have as calming voice as you do. I'm not sure, but I'm certainly happy to present this area because I think the infusion of mental health into every aspect of the program is just so meaningful. And I think programs have been trying to do that for many, many years. I think the other really big, and these are kind of the highlights, the multidisciplinary team. They've really, I think the Office of Head Start really listened and changed it from establishing sort of a dedicated team to a multidisciplinary approach. And I just want to say that I think while some folks could feel relieved, the responsibility now of figuring out how that approach and how it's going to be demonstrated and how a program can articulate that is something that I think programs are really going to have to think through very carefully. Clearly, they've always talked about preventative and strength-based approach, and clearly just reinforcing that around mental health. And I think the third bullet, the thing that sticks out to me is not only are they concerned about mental health as a part of child development, it's really thinking about the mental health of the adults who care for the children. That is really important. And I know many of you have expressed the level of stress that many of your staff have felt over the past couple of years, especially since post-COVID. And we're going to talk about the flexibilities in meeting the monthly mental health consultation. We're also happy to see, again, the emphasis on collaborating with parents, particularly in mental health and the well-being of their children. And the next bullet, I have to say, I'm not quite sure, and this is a question I would have probably punt to OHS. Mental health is added to the requirement for advance parent permission for any procedures or services, as well as policies for health and mental health emergencies. My question is, what would a mental health procedure be that you would ask for advance consent? So again, we don't have all the answers, but we're raising issues that we think we need more clarity about. And I think that the third bullet is reminding us that preventive and primary care includes mental health. And the same for the last bullet. When you're doing assessment of nutritional health, you really have to consider the developmental and mental health concerns of the child. Now, let's take a look at the multidisciplinary approach. What is interesting here, while they may have dropped the dedicated team, it's like what Kathleen said earlier around some of the staff wellness things. While the prescriptiveness may be gone, you're still responsible for creating that program-wide culture. And again, the duties really, I don't think change much from the NPRM that you are required to do under the multidisciplinary approach. And again, I think if you can take a look at that second bullet, really stressing, we're talking about this approach really to be inclusive of all children in all program options. So I think that that's really an important point. Something that I think is new, and for me, if I were a program person, I might think, how are we going to do this? You have ongoing mental health consultation services, but now you're required to do an annual assessment. Is our program approach right? Is it meeting the needs of the children and families and staff? Again, putting an emphasis on the child's social emotional screening with appropriate follow-up and partnership again with parents. Again, these are all things that have got to be under the multidisciplinary approach umbrella, but how you choose to assign those responsibilities or what systems you set up, certainly you've got the flexibility. And you can see the last two is coordination and collaboration between mental health and other relevant program services. And I think a new or heightened role for the mental health SAC is to build community partnerships that facilitate access to mental health resources and services. So I think it's very intentional there. So when we shift then to the mental health consultation, it's now no less than once a month. But clearly there is an opportunity for the program to decide how that once a month, what does that look like? The other thing that I know many programs were very happy with in the NPRM is that there was flexibility, understanding the lack of adequate numbers of mental health licensed workers in this country, that a program can hire a person working towards a license, so long as they're under the supervision of a licensed mental health professional. I think the other flexibility that was added in the final rule was to further expand the pool of who those mental health professionals could be in cases where they did not have enough license or those in the process of obtaining a license, expanding it to mental health professionals, behavioral support specialists. And I think a very sensitive addition is the traditional practitioners, and this is really important within tribal communities. And all of that is to be done, of course, in collaboration and coordination with the mental health consultant. So I think that those are ones that really folks will embrace. And again, I think to point out that the mental health consultant really can work with any staff, not just teachers, and certainly with families as opposed to just parents. And again, I think the mental health consultant has an extremely important role, and we'll get into suspension and expulsion later, but they have an important role to play in developing the interventions, the strategies, and making critical decisions about, I would say, suspension, because Kathleen and I have talked about this. There's really not much to say about expulsion because it's not allowed. So I think we want to spend more time on suspension a little bit later down. So I think we're going to roll right into the safety practices, and I think I'm still on, correct, Kathleen? Again, this is a really, really important area that I think will warrant many, many additional conversations. But it really broadens the notion of who needs to adhere to child health and safety requirements. And it emphasizes, takes away any confusion that there was in the past, that ensures no child is left alone or unsupervised. And volunteers can never be left alone with children. And there's something I want to point out here, and I wanted to point it out earlier. we are talking about what the requirements are. Some of what we are sharing with you is in the preamble and may not be specifically stated in a new requirement or a revised requirement. And I'll point that out as we go along. And the reason I'm saying that is it is so important not to neglect the preamble, because it gives you information that sometimes completes what a revised requirement or a new requirement is intended to be. So I just want to stress that the preamble is really important. Again, the requirement, we're very clear that there's annual training on positive emotional support and annual training for mandated reporters. We're happy that we see a codified timeline for reporting incidents, which we'll talk a little bit more. And again, I think the standards of conduct have been streamlined, and there are categories of maltreatment and that really focuses on endangering children's health and safety. What we have is some additions, and I think again a reemphasis of contracts and volunteers are absolutely required to follow safety requirements, just as staff and consultants were required to do previously. And the final rule makes a distinction as to what do we mean by contractors, and that certainly alleviates programs who often ask, what about the guy that's doing the plumbing, after school is over, or the gardener? We're talking about people that have direct contact with children or anyone that has unsupervised access to children. Again, I think streamlining, aligning the definition of child abuse and neglect with the Child Abuse and Prevention Treatment Act is important. I think it just eliminates confusion. And again, the final rule reinforces if discrepancies exist between state, local, and tribe. Obviously, when it comes to reporting, you comply with the most stringent. Now, what's interesting here, and a little thing that Kathleen and I sort of had to like think through and really figure this out, but what's interesting is a program must do annual training on mandated reporting for their staff. And contractors, consultants, and volunteers must follow safety practices because they are mandated reporters. However, there's flexibility for programs to determine how to provide information to those groups of contractors, consultants, and volunteers for understanding the requirements around mandated reporting. So again, that's a flexibility given to the program for these groups, but clearly not for your staff, which is required annual reporting. If we could go on. And here's where I know in the NPRM, it was alluded that they would provide examples for the categories of child maltreatment. And I think that it is helpful to have, you can see under the definition of corporal punishment, you can see the examples. But I think that clearly it was stated several times, and probably both in the actual language of the requirement and in the preamble, that these are examples. These are not exhaustive lists, but I think that they really help us in understanding really what falls under that bucket. And you can take a look and read these definitions. I'm not going to go through every one of them, but clearly we can go to the next. But I think the sexually abusive, the addition of that, and as well as providing examples, is really very helpful. If we could go to the next, the last two categories, emotionally harmful behavior. And I think the thing that I would want to stress here is we're talking about things that harm a child's self-worth or emotional well-being that are clearly not permissible. And I say that because this is where discussions need to be had. What would not rise to that? And again, those are, I think, more deeper dive conversations down the road. And they give us some examples of what emotionally harmful abusive behavior would be. Again, the last one, the category of neglectful behavior. I think giving again some examples, leaving a child unattended on a bus, withholding food as punishment, or refusing to change soiled diapers as punishment. I think better help us understand what the intent is here with neglectful behavior.
And
So
if I
when we
could just
talked,
chime in, if
yes,
I could
please.
just chime in, because I think this is one of the things that a change that's so important
Yep.
is that I won't say that the language was narrowed as much as it was clarified in a way that some of the examples that we raised, by the way it was originally drafted, it scooped up all kinds of behavior that
Right.
was not harmful to the child, but in fact was, restraining a child from hitting another child, like things like that. And that this really did take it to what all of us would see as truly problematic behavior.
And I think we'll probably emphasize that a little bit, but I think it's really important to bring up and to continue to discuss that point. Um, Again, it's codified, as I said. You now have 7 days to report an incident, um, and no later than 7 days. But what you will find in the preamble, and this is another thing, while the requirement may say no longer than 7 days, the first day that you were aware of the incident is day 0. So you essentially have 7 days from the date you were aware of the incident to report. So I think that that's, again, reading the preamble. I mean, it's just a little minor adjustment, but it's important to understand what the 7 days includes. Um, and again, it clarifies, I think, very clearly. We're talking about incidents that include, again, staff contractors, volunteers who participate in a setting that receives Head Start funding, regardless of the child's Head Start funding, and a child who participates in a setting that receives Head Start funding. One thing that that has changed in the requirement, there used to be a requirement that said report school closures for any reason, which led to a lot of over-reporting. Now, what the new requirement says, it must report program closures. But what the preamble tells you is we're not talking about scheduled breaks, we're not talking about holidays, and we're not talking about short-term closures due to inclement weather. So again, the preamble is saying, okay, it's giving you some guidance there. What is it that I have to report? And it's not everything that you thought you had to report in the past. And again, it's a way of continuing to focus on things that are more significant than those things that are less significant. And we can move on. So again, as we have talked about a couple of times, this is really a shift in the final rule. And it's really shifting the focus to serious health and safety incidences and reducing the over-reporting of non-serious and non-harmful incidents. And I think that we hope that people embrace this, because I think we all want to be focused on the things that are serious and the things that are harmful, not worrying about the reporting of things that don't fall into that serious category. And again, this was consistent, I think, with the NPRM, things that report maltreatment as well as serious harm or endangerment that result from lack of preventative maintenance or lack of supervision. And again, things that also required to report other significant health and safety incidences involving serious harm or injury. And this reminds me of the program saying, oh, the little child scraped his knee and, whatever, and we had to put a Band-Aid on. That really is not serious harm or injury. So again, I think these warrant lots of conversations for people to get comfortable with what falls in what bucket. And again, the report incidents, they're trying to distinguish here that if there's a parent in a program and in their role as a volunteer employee violates any of the codes of conduct, that would be reportable. Versus if a parent does something in their home that's related to child abuse, that's not something that would be reported to the Office of Head Start. And again, and there is a specific standard that even uses the word autonomy. And again, this gets back to Kathleen's point. Incidences that do not rise to the level of significant injury, harm, or endangerment, but may not be best practice, are the program's responsibility to address and do not require an incident report to ACF. So we think that this is really important. And the final rule also indicates may need to report an incident to the state that doesn't rise to the severity and significance described in the final rule, but is not reportable to ACF. And Kathleen, if I'm not clear in any of this, just raise your hand.
I think we'll be getting back to some of this, judging by peeking at the questions. I think that
Yeah.
we'll be getting back to some of this for sure.
Yeah.
But first, we continue onward. Other changes. Let's go ahead and start talking about those. First of all, the community assessment. So the final rule, like the NPRM, proposes to revise the community assessment process to make it easier, basically streamline it, simplify it, etc. It encourages programs to use your own knowledge and existing data and data beyond just counts of eligible population and resources, and also collecting data from enrolled and prospective families to reflect lived experiences. This last bullet is new, and ACF indicates that they will provide additional guidance and support on best practices in this area, but they have added that as something that they're encouraging folks to do. Likewise, as with the proposed rule, they're wanting to make sure that transportation needs and resources are a part of data collection. And the final rule also clarified that, once every 5 years is how frequently you have to do your community assessment. And the annual review is not meant to be a full shebang. It can be, supported by an annual self-assessment and funding application. It must examine changes to families experiencing homelessness in your community and must include race, ethnicity, and children living in poverty in it. But it is not expected to be a full-on 5-year needs assessment. So programs must give families the option to use modern technologies to encourage and assist them in applying, but it's not required. Basically, families should be your guide, like the needs and capacity of your families for both this particular point and then the next few slides that we'll be talking about, that their needs are what comes first. And that includes using modern technology, but it also includes using pencil and paper if in fact that's what you need for reaching your particular families. So again, communication methods and modalities that are best to engage families of all abilities, and ongoing communication with your community should also be in a format that's most accessible. All right, housing costs. This is an option, first of all. So if you don't think it applies to you, then you can disregard. But as with the proposed rule, if housing costs are in excess of 30% of gross income, programs may reduce that gross income by the amount above that threshold. And OHS noted on its webinar the other day that they will be putting together a tool that will assist you in doing this calculation, which hopefully will come as a little bit of stress relief to folks who are worried about accurately making that calculation. Housing costs include total expenses, not just rent or a mortgage, but also utilities, insurance, taxes, etc. And then new to the final rule, the bills and expenses to do this calculation can be used from 1 month and calculate that out to be an average throughout the year. So that should be a paperwork simplification that a lot of folks had concerns about. For this slide and the next one, tribal eligibility and then migrant and seasonal eligibility, both of these things were included in statutory language in the most recent Appropriations Act earlier this year. So tribal programs now have the discretion to consider eligibility regardless of income, and they may use their selection criteria to prioritize children in which a child, family member, or member of the household is a member of an Indian tribe. For migrant and seasonal eligibility, it's a little bit similar. To be eligible, one family member must primarily be engaged in agricultural employment, even if they don't meet other eligibility requirements. And then also something that is a welcome change is that migrant and seasonal programs no longer have to verify infant and toddler eligibility after 2 years. Instead, this aligns with the traditional early Head Start requirement for non-migrant and seasonal programs. Okay.
All right.
I think that's
I guess
you.
Okay, let's switch to the other changes, and we have several categories of other changes. And again, it's interesting, right when Kathleen was talking about the community assessment, it's really interesting because you see really an important emphasis on taking a look at the barriers to enrollment and attendance for regular attendance and enrollment. And really, I think we are looking something I just confirm your speaking language. I'm trying to speak English. I just got a little box up there.
I did too, and I don't even know what that was.
Okay. So again, I think we know how much this has been a discussion for programs for many years. We know how difficult it is. The costs of transportation are very high. Many programs have dropped transportation, but I think that with the final rule, programs are going to be held accountable to really look at what the barriers are. Again, and certainly transportation, we know was one of those barriers. And I think you can see by the second bullet, and where possible, if it is, provides or facilitates transportation if needed. Serving children with disabilities. Now, here is my the first bullet is what was in the NPRM and is in the final, but there is in the preamble a sentence that says, and I think again, it's important to understand the messaging also. While the first one is the requirement, the second one is really the Office of Head Start saying 10% of actual enrollment is really considered a floor, and OHS encourages programs to serve as many children as possible with disabilities. So again, the emphasis on understanding sort of the mindset and the intent, even though what we see in the actual Head Start performance standards is the first bullet. We can go on to the next one. So suspension. We know that this happens very rarely within a program. We know how difficult this is. And I think here in the final rule, I think that the Office of Head Start is making us look at suspension very seriously. And I would have to say the actions and the documentation is going to be really important to support an agency's decision to suspend a child. And you're really talking about, here's the definition, a serious threat that has not been reduced, eliminated by providing intervention supports recommended by the mental health consultant. And it could be others. And there's an acknowledgement that the program needs more time to put these appropriate services in place. And again, temporary removal. We're really talking about when a children ceases attendance for a period of time. reduces the days and time a child may attend, removal from the group setting for an extended period of time, or requiring a parent or designee to pick up a child for reasons other than illness or injury. And again, here, I think, again, the demonstration requires programs to explore all possible steps and document the steps to facilitate the child's reentry into the program. I think that this is really an important issue here, exploring the steps and being able to articulate what you went through to make the decisions you made. And again, this is where they're infusing the multidisciplinary approach, and the importance of engaging and supporting the child during a suspension, not only the child, but the family, and again, providing additional program supports and services, including home visits and, of course, coordinating if a child is on an IEP or IFSP. And again, we're being a little bit repetitive here, but I think it's really important. Again, I think that the final rule acknowledges that programs may need time to put additional services in place in order to provide interventions and supports appropriate for the child. And again, the connection with the mental health consultant is critical here. And this last bullet, I think is, I fully understand if a program makes a determination there's a more appropriate placement for the child, the program must directly facilitate the transition to the more appropriate setting that can immediately enroll the child. I think what is difficult about this, and I know that many programs, particularly in rural communities, are going to say, but there are no other appropriate programs, or if there are, I was talking to someone who told me there was a 5-year waiting list. So I think that while, and I understand the language and its aspirations, I think in many communities this is just hard. So if we could move on. And final rule makes note that momentarily removing a child is not a suspension, nor is acting in accordance with the child's, again, individual educational plan or family service plan. And stressing temporary suspension is only used as a last resort. I think that's where we started with the suspension discussion, and this is where we end it. But I know this happens rarely, but it's really an important section of the final rule to fully understand and to understand what the program's responsibilities are in managing a suspension and being able to articulate and document what they have done. I think we could move on. I can go through these quickly. We know the NPRM proposed 1-to-3 ratio for early Head Start. Doesn't mean you can't do it, but the requirement is dropped. The same thing, maintaining the 1380 hours for early Head Start center-based services, which has been on the books for many years now. But there was a proposed to do 46 weeks of codified, 46 weeks of continued center-based services for early Head Start children, and that requirement has also been dropped. Ratios in family childcare settings, the one thing that I would want to draw your attention to, I think the first ones are just clarifications from the previous language to what's in the final rule. The third bullet, we're really talking about assistant providers or something that we're not going to talk about anymore. They don't exist. The Office of Head Start is really in the final rule, basically saying in a home where there's required to have two providers, they are really two family child care providers who both either have their family child care CDA or state equivalent or in the process and must have it 18 months after hire.
Okay. Last batch of so-called other changes. Let's go. And we will still have time for questions at the end. First of all, preventing and addressing lead exposure. So this was a significant change. The final rule requires programs to develop a plan to prevent children from being exposed to lead in paint or water. In the draft rule, the proposed rule, it was much more prescriptive, but this really gives more latitude based on where you are in the country, how old your facility is, it's how much remediation you've already done, all of this kind of stuff. So everyone will have to develop a plan because obviously avoiding lead exposure is a priority health concern, but there's a lot more flexibility. So in facilities, whoops, if you could go back, in facilities where lead may exist, this does include testing and inspection at least every 2 years with support from trained professionals. And then, of course, if lead hazards are present, you have to engage in remediation and abatement actions immediately. Family service worker assignments, the caseloads are remaining at 40-1. They may temporarily exceed this ratio if you have a staff absence or attrition or an emergency response of some kind. And then there may be limited waiver authority pending further guidance. So a little bit more, some small exemptions to that 40-1 ratio. And then family services is replaced with family partnership services. As in the final rule, QRIS participation, it is encouraged, but it is not required. So that was retained. Services to enrolled pregnant women. So the rule defines family compositions. It requires more specifics in supporting pregnant women and their families to access mental health services and review certain topics, and as well as addressing pregnant women's needs for appropriate supports, which include categories such as social and emotional well-being, nurturing and responsive caregiving, and family engagement with the father, partner, or other family members. Safe sleep was added to the list of required topics to be discussed during the newborn visit, which was directly from some comments from some or many of the comments from the public. So that was added. An important clarification is that the newborn visit must be scheduled within 2 weeks after birth. It does not have to necessarily be conducted within 2 weeks. And then there are requirements for tracking and documenting services to pregnant women to be able to articulate more clearly how you frame your services and your engagement with pregnant folks. And then, in addition, programs must act in a way that reduces disparities in maternal outcomes. We know that birth outcomes are particularly troubling for Black women in particular, and taking steps to address those disparities is a requirement in this rule. And then last, maternal health curriculum, if one is used, must be one that's best for families.
Kathleen, one of the things that I think we have not done consistently, but there is a compliance chart. I saw a question pop up. You mean we 40-1 caseloads right now? Or so I think an acknowledgement that the compliance dates are, many of them are staggered throughout. And so there is a chart that will bring clarity as to when the compliance dates are for many of the findings that are not effective 60 days after the issuance of the final rule.
That's right. That's exactly right. For facilities, there are a number of changes to improve the 1303 process, greater flexibility and certainty. Here are a few examples. The terms cost and fair market are removed. Appraisals can be done virtually, and Anne tells me this is important, so we bolded it. HHS must approve reasonable requests to use federal funds for the costs associated with their preliminary eligibility process, their work, and then the costs that they incur in getting that process started.
And Kathleen, I think the reason why I thought that one was so important was sometimes a program can get permission to use funds to do preliminary workups and estimates and all that great stuff. And there probably are some situations where the proposal, the request is going to be rejected, that the project would not be approved. But in those cases, if the program had prior approval to use funds to do preliminary work, they would still remain, those funds would still be allowable, regardless of the outcome of the final determination of approval or not of the project.
Exactly. Exactly. So in the still in the facilities category, the definition of federal interest and major renovations, there's a definition tweak. But importantly, the threshold is raised to $350,000 for a major renovation, and future increases are aligned to the National Defense Authorization Act. And then last, an important provision for tribes, those who apply jointly to use both CCDF and Head Start funds can use the CCDF threshold if it's higher. Okay, so here at the end, we just have a few definitions that we will let you take a look at independently. Things like we're going to all get used to saying Head Start preschool because that is now the term. Head Start's the umbrella term for all flavors of Head Start, if you will. And so if you could just move the slides ahead a couple, keep going. Definition of income is written there on the slide. It's very clear. It articulates that just those income sources are the ones that will be used for calculating income. Okay, next steps. Be on your lookout for this PowerPoint and a final rule summary, which will come to your inboxes in the next day or so. We at NHSA are also offering monthly in-depth workshops for members that is focused on implementation. So this is where the Dr. Bergeron and some of her colleagues from NHSA really start digging in on answering the questions. How do I do this? What does this mean? How can we all process this together? So you'll see these dates once a month through the end of the year. And then we also are still in discussions ourselves about other forms of support that we might be able to give to you, and look forward to being able to provide a little more certainty in the weeks ahead, but nothing is set quite yet. So next slide. All right. I will just say that we have heard from a lot of you about your excitement, your trepidation, your opposition to implementing the new requirements. And I hope that you've come away from this presentation with a slightly more optimistic view of what changes lie in store for programs. We are committed to supporting you and working through this process together. And most especially, or maybe not most especially, but our fight for increased funding will absolutely continue. This is just the beginning. We now have certainty on what we're going to be needing, what Head Start programs are going to be needing. And so our fight for additional funding really, really continues. So I would like to just, Anne?
Oh, no.
Oh,
I'm
sorry.
good.
I thought you just said something. So keep raising your questions and concerns. There are issues that we haven't even thought of yet, some of which we've seen in the chat. And we look forward to continuing a dialogue with you. So this leaves us with about 15 minutes for questions, and we will do our very best to answer what we can, and to, there might be some that
that we send over to our friends at the Office of Head Start instead. So.
Excellent. Well, let me jump in now. We have quite a number of questions, and we'll get through as many as we can, and keep them coming. I see them continuing to come there. Let's start. I've tried to arrange them, and shout out to Katie and our team for helping me keep track of all these questions. Tried to arrange them based off of the topics as we go. So let's kind of run through them as much as we can, and we'll do as much of a popcorn quick answer format. Ann and Kathleen, looking to you too for that popcorn quick answer. Or if we don't know, we'll look to pass these on. And again, we will, as was noted, we are going to look to share this with OHS. We are not going to be sharing attributed to names. They're going to be anonymous, just as one big batch of here are a lot of the questions that we got, really good questions that came in. So first question that I think is a really important one. Do we need to wait until October 21st to start implementing these changes, or can we begin now?
Heck
Wow.
no.
My goodness, go for
You
it.
can, I mean, yeah, absolutely. And some of you, we know you've been doing some of these things all along. You told us that in your feedback when we were collecting comments for the NPRM.
The
So
effective date is immediately, like if the technical way it's described is effective immediately, and compliance date of 2 months from now.
correct, or unless otherwise stated.
Unless otherwise stated, that's right.
But no reason not to start moving towards any of these pieces as well. Second, is there, I think we responded in the chat, got a couple of questions though, asking for the specific link to the preamble. Katie, if you wouldn't mind dropping that just one more time so folks can see that, about where they can find the preamble, but I think that is covered in the chat.
I think it's worth, though, we use that term, Tommy, and I don't think that folks are necessarily understand what it is. So both for the proposed rule and for the final rule, there's the actual language that changes the standards, which I just printed out hard copy because I've needed it. But then there's also the discussion about it. And that's what we mean when we refer to the preamble. So really, like, more than 50% of the rule itself is discussion. And then there's the line by line changes.
Yep.
And so it's the combination of those two things. That's what we mean
Good.
when we say preamble.
Good clarification. Good clarification. Got a number of questions about the 200 slot waiver or less. And so let me try to arrange a couple of them, and hopefully we can knock them out here. But do programs with 200 or less slots, are they going to need to submit a waiver, or is their exemption regarding most wage and benefit requirements automatic? And do you know?
Well, I think it's a really good question that we would want to ask OHS, because the requirement says programs with 200 or less slots. I don't know if they say they may be or are. I think the devil is in the words, right? But I think that's a really important question. I would lean to, I bet they don't have to, because their notice of grant award is going to have the number that they're funded for.
Yep.
So it seems to me that would dictate, but I think we need to go to the authoritative source for a definitive answer.
And that's a
Good
good
question.
example of an area that we do want to have a definitive answer, because that is very process oriented. It's either yes or no. And so we'll definitely include that. Similarly, is the enrollment of 200 considered by program, aka Head Start enrollment or early Head Start enrollment, or is it combined? Is it based on the grant? Is it based on the grant recipient? Etc. A lot of questions about this space that I think is leading to a lot of confusion.
And I actually saw one question pop up, and I think someone said, well, what if we're a delegate and we're only funded for, 75 kids? Again, I don't think that we want to jump to a conclusion. I think people have raised a really good question. I would tend to think grant recipient, the exemption would be tethered to the grant and the funded enrollment of the grant. But I really feel like that's one where we need to go again to the authoritative source and say.
Yeah. And I will flag in, I mean, and for those of you that were on the call on Monday, Director Garvin did state on that call on Monday that it is connected to the grant. but not necessarily not to the delegate. So I think that that's that. But do we happen to know off the top of our heads early Head Start, or we're still a little unclear about, like, if you have a early Head Start grant that serves 150 slots and a Head Start grant that serves 300, or I guess I shouldn't say 49 slots. Should do that backwards, but you get my point. Does that mean that the program is
Well, I think it's an excellent question, Tommy, because you could potentially have a program that has two distinct early Head Start grants. Now, I know that the Office of Head Start has been trying to combine them, but let's say they have two distinct grant numbers, and one's for 150 kids and the other one's for 250 kids. So I think this is, people are raising such smart issues that we need to get clarification on, and it's great to have these be raised surface early.
So I'm fearing the similar response. Let me keep going here, though. Leads to another question that says, how will consideration be given to this requirement if meeting the compensation requirement would require a significant reduction in slots? And similarly, the requirement is only requires, does the requirement apply to contractors as well as to staff? In other words, family child care educators who provide early Head Start services through a signed partnership agreement, different than necessarily through a delegate grantee relationship, grant recipient, relationship.
I don't think we want to
Okay, so stay
conclude
tuned.
that we knew what the answers were. I think that these are, again, great nuances that people are raising early.
Yep. Any thoughts on how a program calculates the salary needed to cover cost of living? What will be needed to prove this calculation?
So salaries, so they have in, I think it was the NPRM preamble, they had a few possible options that they listed. They're not endorsing any one, but one example is the MIT living wage calculator. And you can plug in your zip code basically, and it will calculate what the a living wage would be. And so they're saying use a reasonable standard to be able to calculate that for your regional area, your city, your county, something like that.
And I want to just add, Kathleen, I think that this is a really good, and please jump in here if you all have more to add, but I think that this is a really good example of one of those things where we may not actually want to ask the Office of Head Start for definitive guidance, because there might be a few different ways to do this effectively. And I think having that, I believe, yes, Bihana, that is the livingwage.mit.edu is the one we're talking about. We will look to provide some additional resources and trainings and things like that, and guidance, I think, from a kind of best practice type perspective that we certainly can share in some of our future webinars. But I just wanted to flag, this is probably one of those areas that we probably don't want OHS to tell us you have to use this or you have to use this or anything like that. It really is an opportunity for us to be a little creative in our own communities, although that is a little confusing.
Well, Tommy, I think the one thing that I would say, and this applies to many things, is so long as a program can justify their methodology and it's reasonable. And so I think there are many methodologies and many paths, but I think it's got to be something that they can say, this is how we did it, and it's reasonable because.
And I love that point. That's something I think, especially for newer directors and folks newer to Head Start, sometimes it does feel like there's a lot of very clear, you have to do it this, and this. But what Ann just said, I think, is such an important thing, that there is opportunity for us to really define how we think and explain and document what our kind of thought process and leverage that opportunity for flexibility. Another question on wage studies. It sounds like wage studies are every 5 years instead of every 3 years, based off of the person cites page 67 of the track changes document. Is that how we're reading it as well?
I think it's an evaluation every 5 years. Am I correct, Kathleen?
I believe so. Sorry, I was momentarily mixing it up with something else right now. But I believe that's like a reassessment every 5 years is what I understand to be the case.
Okay. And then last question on salary here, and wages. Can salary be based on 90% of school district kindergarten through third grade, or does it have to be based on preschool salary?
I believe it says that it should be based on preschool, but in instances where that's not available, then you can use kindergarten teacher salaries.
Thank you. Number of questions on mental health services. Our
Yes.
monthly mental health consultation our monthly mental health consulting observations, or can they be meetings with staff? Oh, I misread this. I'm sorry. Are monthly mental health consultations considered observations, or can they be considered meetings with staff?
Think this is another area where, and again, reading the preamble is going to be important because I think people thought historically that monthly consultation meant you had to observe in every classroom, or you had to figure out what classrooms you're observing in. I think that OHS is describing the better models for consultation, and it may not necessarily be that person in the classroom. It could be meeting with a group of teachers who present, what they feel are issues that they're having difficulty with within a classroom. So again, I don't think that if OHS intended that to be specifically monthly visits, observations to a classroom, then the regulation would have said that.
Really good point. Really good point. Back into that line of this flexibility might be an opportunity for us as well. Can consultation be done by an endorsed mental health consultant with a licensed mental health professional who oversees the multidisciplinary approach?
That's a big question. Can you say that again?
Yeah, of course.
I would say yes, but I want to hear the question again.
I believe that's the case based off how I'm reading this too. But can consultation be done by an endorsed mental health consultant with a licensed mental health professional overseeing the multidisciplinary approach?
I'm not quite sure I understand the question because it sounds really good. You've got a licensed mental health person at the top, and you've got another mental health licensed person doing the work with the multidisciplinary approach.
I think that we're getting into a little bit of the weeds of what is considered an endorsed versus licensed versus all these things, which can be
Okay.
different things. So I to this point, I think the key is we need to have the licensed mental health professional overseeing basically
Yep.
everything, and it does the rule does mention, here we go. The final rule mentions behavioral specialists, but can we use endorsed consultants as well? And I'm
I
assuming
don't know what endorsed consultant, because that language is not used. I think there is language used for traditional practitioners, which are identified particularly in the tribal community. So I don't know. Again, I think that this is nuanced. I think it's important. I think it's a place where we probably need some guidance. So I would want not to answer it definitively, except for what you said, Tommy, and put it aside. And I think we need to push it to our colleagues in OHS.
Yeah. And I see we're already coming at a closer up to time, and we have so much more that we could continue on in here. But let me just do a couple examples, quick on some of the reporting requirements. And again, tons of really great questions. We're going to keep passing these on and keep finding opportunities for you to get answers to them. So apologies, we're not going to be able to answer every single one here. Where was I going to say? Where was it? Here we go. So in terms of the reporting, what if we have to close a classroom due to staffing issues? Is that something that's reportable?
You want to take a stab at that, Anne?
No, I want to punt to you, Kathleen.
I'll take a guess. I think that the intent behind this is for the small and short-term temporary things, closures, to not be something that has to be reported. But maybe you do have to, you're lacking a teacher and you have to close a classroom, but you've hired a teacher and they can't start for another 10 days because of background check or what have you. Do you have to report that interim closure, or do you have it under control? and that the intent is there, and that you have a plan for reopening. So, you know, my feeling is that the short-term temporary things are the ones that shouldn't have to be reported, but if you're having an ongoing issue, that your program specialist would want to know.
I think OHS would want to weigh in on this one very much because,
Yeah.
you know, what's temporary? Is it an afternoon? Is it a
Yeah.
morning closure? Is it one day? Is it, you know, when does it become? So it is, but it's a good question.
Yeah. There's a number of specific examples that have been put up here, and HVAC being out, water leak, those types of no electricity. I think that these are big things. Again, we'll flag all of this, and hopefully they can cover some of this in their webinar coming up next week.
But I think if I could just say here, I think the overall concept that we have to get comfortable with is, like, what is the area where we need more specificity versus we can work within the parameters that we've been given, right? And so it sounds, based on that litany of examples that Tommy just read off, that we probably need a little bit more guidance here, but not to
Mhm.
the extent of which of like 2 days is okay, but 3 days is not okay. Like that level of micro regulation is what we told OHS we did not want to have happen. And so that means we're going to have to get comfortable with a certain amount of gray area for us to really interpret.
Yeah, well, let's go ahead and bring it in for a closing then. And Kathleen, that's a really good point, because I think as we look at where before we sign off, I wanted to flag just a couple of things. One of them was exactly where Kathleen was just going. And that really is to acknowledge that we are really in a new phase of the rulemaking process. Right? We are now in the phase where unpacking, understanding, and really processing what these changes mean for each and every one of our programs, and by when we need to be making these changes, is really, that's really what we need to do right now. I think the question that we're trying to struggle with now is not what needs to change about the final rule, but how do we meet these requirements? And the questions that we're seeing come in here very much fit with that. But I want to really encourage everyone that I think now is the time for us to get creative. Now is the time to get innovative. Now is the time to really take advantage of the flexibility and to think like, okay, so this is a little bit vague. Does that vagueness give me an opportunity to do something that I would like to be done because it's in the best interest of children, families, and my communities? Or is it actually so confusing that I actually don't know which one is which and we do need more clarity? Those are the types of things that that's really where we are in the process right now, and would encourage us all to be thinking of. As I said, some things will need clarification, but before we really push OHS to put out a program instruction or an information memorandum or other type of formal clarification, we really encourage you to take advantage of those flexibilities, because we asked for them, right? In a lot of spaces, that was really part of our comments. And there are some things that we probably don't want those additional clarifications.
Tommy, could I offer just one more?
Yeah, I'm about to close it out, but really, really quick, Ann.
I just want to offer one more comment. When we talk about looking to OHS for clarification, and I say this with deepest respect to the regional offices, this is a new rule. If there are questions to be answered or guidance to be issued, I don't think it would be in the best interest to call a program specialist who may want to try to help. But I think we want consistency across the country, and it's so critical in the initial stages. So I just want to say that.
Okay, great. Well, let me skip basically all of the concluding remarks that the other concluding remarks I was gonna say, and fast forward just to this one for time's sake. And it is to acknowledge that we are going to need to, our next step on this, after we're understanding it, after we're unpacking it, after we're getting a sense of it, really our next big step is going to need to be to figuring out what we need from Capitol Hill to make this work. Right? This is going to be a process that's not going to happen overnight. This is going to take some time. Our team at NHSA has already engaged some of the leadership on Capitol Hill. I know Kathleen had a meeting earlier this morning with the senior appropriations staffer. And we have been engaging with the Hill throughout the rulemaking process to make sure that we're not starting from scratch. However, we are also asking for your help with this. We need to make sure that you are digging through this, that you are identifying what types of costs you might need, that you're sharing that with us. And that if you're coming across assumptions or things that you see in this final rule that don't make sense, or you think are under the amount that it would cost, we really rely on your expertise to help us figure out what those projections should be. That also means informing and educating our parents and our caregivers, as well as our staff, about what is and what isn't the final rule. If we're going to make this change, and if we're going to get the resources needed from Capitol Hill, we're going to need everyone to be aware about the impacts of the rule. And we also have to acknowledge that we're in a hyper-partisan time right now. We are less than 75 days from the presidential election, which may make everybody excited that we're getting that close, but it is hyper-political. That's why we've seen such strong statements coming from the administration about all these great things that the rule does for the workforce, yet it kind of ignores the reality that we need dollars to be able to do that. And that longer term challenge is left alone. So I really want to just end by thanking, in particular, Kathleen, thanking Anne, thanking Katie, who's been behind the scenes, getting all these questions in place and helping us analyze everything in this space. I also really want to thank all of you. Thank you for joining us. Thank you for staying in touch. Thank you for dealing with the difficult changes that we're navigating with a perspective of hope and opportunity, rather than the feeling of loss, like many of us might have. So please stay in touch. Let us know what additional resources, what additional webinars, trainings, what have you, could be helpful. We're going to, as Kathleen had noted earlier, wait until we see the webinar next Wednesday before we schedule anything else. And then certainly are going to be looking towards our workshops, the member benefit that we have, that Dr. B and her team are largely going to be leading to help you figure out how to implement everything here. And above all else, thank you. Hope everybody has a great rest of the day. Take care, stay in touch, and we'll talk soon. Thanks, everybody.